June is National Scoliosis Awareness Month. It is sponsored by the National Scoliosis Foundation, a patient-led organization that is dedicated to helping children, parents, adults, and healthcare providers to understand spinal deformities such as scoliosis. Scoliosis is an abnormal curving of the spine. Everyone's spine curves a bit, but people with scoliosis have a spine that curves too much. The spine might have a C-shape or an S-shaped look. Scoliosis affects about 7 million people in the United States. Scoliosis spinal curve of 10 degrees or less affects 1.5% to 3% of individuals. It is most common in the late childhood. It is more common in girls than it is in guys. It normally occurs during a big growth spurt in the child, most of the time right before the teen years or at the start of the teen years. In 85% of cases, the cause of scoliosis is unknown. It mainly depends on the type of curve that the person has. Some doctors believe it is genetics and that you inherit it from your parents, but that is yet to be proven. The other 15% of scoliosis patients fall into two categories, non-structural and structural. Structural is a type that is a temporary condition and the spine is otherwise normal. An example is one leg is longer than the other. Structural is when the spine is not normal and this is caused by another disease such as a birth defect. The effects of scoliosis on a person depend on the person's curve. One effect would be misalignment of the body. When the spine curves with scoliosis, the shoulders, waist, and hips aren't in line anymore. This is because the curve moves, affecting the alignment of it. Another effect that may happen in severe cases of scoliosis is damage to the heart or lungs, which is caused when the curve is over 80 degrees because it twists and can crush the lungs or heart when it does. This can affect the breathing rate and the lungs. Other effects are needing to wear a brace, surgery, hip problems, loss of balance, shrinking height, and back pain. The treatment used determined by two main factors: how much growth a person has left and the degree of the curve. There are three main types of treatment: observation, back brace, and scoliosis surgery. Observation. After scoliosis is found, a physician will measure the curve on a regular basis, usually every 6 months, depending on the person. Curves on this observation are normally 15 degrees or less. Back brace. This treatment is for patients who have a curve between 20 and 40 degrees. There is two types of braces, the night brace and the day brace. The night brace is worn at night and pushes the curve opposite the way it's curving. The day brace is worn during the day, normally for about 15 to 18 hours depending on the person. Bracing does not correct the curve. It is meant to slow or stop the progression of the curve. Brace must be worn until skeletal maturity. Scoliosis surgery. Surgery is normally done for curves that have a degree greater than 40. The surgery can correct the curve by about 50% and will also stop progression of the curve. The surgery is performed by adding a number of screws and 2 rods to a person's spine. The surgery takes anywhere from a few hours to 8 hours or more. When a person has to wear a back brace, it may cause them to feel self-conscious about themselves because they look different. For teens, they may be scared of being picked on by others or being the outcast because they have to wear the brace. Although most people wear the brace under their clothing, it is still easily seen. The cost can be a lot for people. There are a lot of doctor visits to watch the curve. If surgery is needed, the cost of that is high, most of the time over $100,000. There are many different signs to scoliosis. A few are your shoulders different heights, or is one shoulder blade more noticeable than the other? Is your head center directly over your waist? Does one hip appear to be higher or more prevalent than the other? Do your ribs appear to be at different heights? Do you have an uneven waist? Do you have any changes in the look of your skin over your spine, such as dimples or any color changes? Do you lean your entire body to one side? This is just a few of the signs. There are many more signs to help prevent the increase of your curve. If you feel like you know someone with these signs, please tell them to look into it. Scoliosis can be fixed very easily when found at an early sign. Please remember to always check younger children or children that just went through a big growth spurt for scoliosis.